who's on. Where is everybody? Come in, guys. Okay, so where are we doing? Let's see. Hey, hi everybody. It has been a minute and a half since the last live, and I promised that we're going to be doing these impromptu lives, especially when I could get some time. So you're welcome. If you're just joining, say hi, where you're watching from. And if you're watching on the replay, of course, you're very much welcome. Thanks for checking out this video. I'll probably rewrite the title when we're finished to reflect the topics that we're going to be talking about. But anyway, how are you doing? How has your week been? It's midweek, isn't it? How has the week been? We're going to be talking about 2 viewer questions. If you're just for the very first time clicking on the channel, my name is Dr. Sylvia. I'm a general practitioner based in the United Kingdom. Here we talk about everything related to women's health, sexual health, general family health, everything to help you feel better, make better decisions about your health. So today I'm going to be tackling 2 viewer questions. Really good ones that came in recently, and I just don't want to leave them dragging. I know I have a lot of viewer questions I'm owing you guys. Hopefully I'll be able to catch up not too distant future. Let me just reposition this. Excuse my creaky chair. Okay, let's get on. So thank you to the 2 people who've posted these questions. Really appreciate you. We'll take them one after the other. The first one, someone says, is it normal to feel pain when peeing? And 1 week after a C-section, 1 week today after a C-section. Really, really good question. Thank you so much for sending that in. Before I get started with the conversation around this, my usual disclaimer, if you're new on the channel, I do tell you that I'm a doctor licensed to practice here in the United Kingdom. I do not provide medical advice or treatment on my YouTube channel or any social media platform, simply because it's not appropriate to do so. I'm not a registered practitioner. Plus, I don't have all the necessary information to be able to provide that essential care and treatment that you need. But we can have conversations around the issues or around symptoms that will help you figure things out better, or go back to see your own doctor with more questions, or get them to examine or do whatever necessary tests. So just that disclaimer before we get started. So thanks for this really great question. Hi Tobias, thanks for joining. Welcome to the live. How are you doing? Where are you watching from? So I'm going to tackle the first question. Pop your question in if I've got time at the end, because I've already got 2 questions which I need to tackle. But if I've got time, then we can cover it. If not, then we can look at doing that in another live. So this question is it normal to feel the pain when passing urine 1 week after a C-section? Well, to the person who sent in the question, well done. It's not easy to go through pregnancy, your C-section, and at this point, trying to recover at home with baby, and I'm wishing you well. And thank you for sending this question, because I think it's quite tricky after you've had a C-section, because you might have niggles and discomfort and all sorts of things going on as expected. So it is tricky. It's actually difficult to work out which one is normal, which one should I worry about, which one should I just keep an eye on it, and how long for. Now, this one relating to, in fact, there are 2 things I want to clarify here. And this is why I say, you can't exactly give advice on YouTube like this. So she says pain when peeing. And so the first question that came into my head was, okay, where is the pain? Is it the pain down below, that is within the vulva, or from the urinary opening? Is it the stinging, burning, feeling like razor blades down within the vulva when you're passing urine? Or is it the pain in your abdomen from the scar? Because at the moment, your womb is contracting back into its pre-pregnancy stage. So those are 2 interesting questions that will give some more context to this particular situation. But we can tackle both of them. I would be concerned about this pain. I would want to have a conversation with your clinician about this pain today, if possible. And let me tell you why. The first thing that comes to mind is, if this is pain from down below, that is in your vulva area, and it's pain when you're weeing in the vulval area, then I would be considering the possibility of, first of all, things that happen commonly, a urinary tract infection. So that is an infection from within the bladder and your urethra. That's the tube that comes out of your bladder. So that's the first thing I'll be considering. I would be that's not normal to have that kind of pain 1 week after a C-section. Remember that during the section, you would have had a catheter, a tube passed into your urinary opening, passed into your bladder through that urinary opening. So that can cause irritation. That could be associated with infection as well, that can develop after you've had the baby. So at least for those reasons, if you develop that kind of discomfort when you're after you've had your baby, then I think it's important that you should get checked out. Other things that you might experience might be you're going to toilet to pass urine more often or more frequently, or you might notice that there is blood in the urine. But 1 week after a C-section, women are still going to experience bleeding. So again, it's a tricky one. It's the one that's not so straightforward. So where have we got to with this question? One, the possibility that the pain could be down below within the vulval area, or it could be pain in the lower abdomen or pelvic area where she's had the section, where she's had the cut. And then we're saying that most likely with this kind of pain, especially if it's coming from down below, it's more likely to be related to a urinary tract infection. But other things could happen. So if it's not an infection, could it be an irritation? The bladder is irritated because, again, like I said, the catheter has been in there. It's usually taken out after, the operation, when you're recovery, and then, your body is trying to recover from surgery. So it's important to bear that in mind. But the other thing I wanted to mention as well is something as simple as, well, it's not simple, but something that we don't often think about at that point is the possibility of dehydration, which could, because the urine is so concentrated, cause irritation as it passes through your tissues down below. And just because you've had a C-section doesn't mean that you might not feel a bit uncomfortable because around the vulvar vaginal area, because during pregnancy, we expect those tissues to show some kind of change because of the hormones. It might be a bit swollen, a bit of discomfort there as well. And that area has been handled while you were having the catheter put in place. So simply having the concentrated urine, if you're not drinking enough, if you're dehydrated, could cause that irritation. But again, very top of my list will be the possibility of a urinary tract infection. Now, what if this is pain what if this is pain from the pelvis, from the lower abdomen? What if it's as she goes to urinate, there is that contraction of the womb that's causing the pain? So we expect some discomfort. It shouldn't be severe. Again, that's another thing that would be useful. How bad, how uncomfortable is the pain? Now, if it's light, momentary pain, and it gets better when you finish passing urine in the abdomen, then we can think, okay, so the womb is contracting, it's still recovering from its size. The size is reducing from pregnancy to post-pregnancy size. And it's better after a few moments, fair enough, you can keep an eye on it. But if this is pain that is persistent or pain that is becoming more and more severe, then it should be looked at. And if you're in the situation where you're not sure, please don't be afraid, or don't hesitate to contact your provider, your midwife or health visitor, or attend the urgent care clinic to get the question asked. Okay, let me just take a quick pause. So Tobias was asking a question, and Tobias, I was handling the questions that came in earlier. So I don't know if you're still here. Need some exercises for my feet. I have foot problems. Is it possible you could make some? So I don't know if that's about making some for the channel. It would be good to know what kind of foot problems. Clearly, I would recommend that you speak to your practitioner so they can first of all examine your feet and work out what's going on, and be clear on what you need, and then that will determine if it's exercise or some of the treatments. But yeah, the other thing that you can do, Tobias, is you can send an email inquiry to my email health information service on AskAwayHealth.org. That gives us the opportunity to look into a bit more detail. No, I can't practice some, unfortunately, because I haven't got the detail. So yeah, you can either see your provider or send that email to the email information service, so that would help. Nope, unfortunately, not on this live stream. Quick, it doesn't work that way. Medical practice needs assessment, so you don't rush things and cause more problems. Let me say hi to somebody else. Vero, hi. Vero Kwashi, hi back. How are you doing? Thank you so much for watching. Where are you watching from? Okay, so we are talking about pain 1 week after a C-section, and we're saying the pain could be down below in the vulva or the vagina, or the pain could be in the lower abdomen or pelvic area. We're not very clear which it is, but I've tried to cover the possibilities. And the bottom line is no, that pain is not normal. Most likely, and this is me not knowing anything else about this person, I don't know how the CS procedure went. Was it complicated by anything? Does she have any other medical problems? These are the important questions that we always have to ask to get the full picture before you can treat or provide the best advice for somebody. But we're sort of going by generally, if you're getting this kind of discomfort, please don't sit at home with it. Do speak to somebody about it, and I would recommend doing so today. If it is a urinary tract infection, for example, then it could get worse very quickly, and it could progress to something like an upper urinary tract infection. So that's affecting the bladder and leads to something that we call pyelonephritis, which is a serious medical condition. In this state where somebody is just after having a baby, you're still quite vulnerable to, different things, including infection. Your immune system is sort of not its best. Even in a healthy person, if you don't treat a urinary tract infection appropriately, it could go on to upper urinary tract infection, go on to even develop something that like sepsis, which is a potentially life-threatening condition. So I'm not trying to frighten you or scare you, but I do want this checking out if you happen to be watching this video and you were the one that sent in this question. Hi Vero, thank you so much for letting me know you're watching from Ghana. It's good to see you guys. Please don't forget to give the video a like. It would really be appreciated if you find this information useful. If you check out what we're doing on the channel, give this video a like. So yeah, I think I've covered irritation from the bladder thanks to the catheter, pain in the pelvic area. That's another possibility. Thank you so much for the like, whoever that was. I appreciate that. And if you're on the live, please don't forget to give it a like, much appreciated. So the key thing is, please don't dismiss this. It's important to get it looked at. Just checking to see if there's anything else to the question that I've missed. I've talked about why it's important to get it checked out, get treated, assuming it's a urine infection, or at least get clarity from your healthcare provider as to what it is. It may be that you just need some stronger pain medicine, or it may be that some further tests need to be done. Whichever the case, please get it checked out sooner rather than later. Okay, fantastic. Let us move to question number 2. If you're just joining the live, you're very much welcome. I'm Dr. Sylvia. I'm a GP. I'm based in Sheffield. And from time to time, I love looking at my viewer questions from this channel. And usually I'll do sort of sit down videos and go into detail. But I've been hit and miss these days because there's so much going on. I thought, let me just hop on the live and address a couple of them. So we've tackled one. So let's go to the second. Where is it gone? The second one, and that's another really interesting question. One thing about you guys send in really interesting questions, and I really appreciate that. So we've tackled the one about pain when peeing 1 week after a C-section. And so this is just an overview. There could be other possible causes of the pain. I think the most important message, take-home message, is don't ignore it. Have it checked out. Speak to your care provider. Go to an urgent care center if need be. Okay, thank you for sending that question. So the second one, which I feel excited about as well, says, does lifting heavy weights affect the IUD? What do you guys think? Let me give you guys the first opportunity to respond. What do you think of that question? Does lifting heavy weights at the gym? So first thing that comes to mind is, how heavy is heavy? Because what is heavy for you might not be heavy for someone else. I know when I go to the gym and I'm simply trying to do my what do you call them, chest presses, or shoulder lifts, or whatever you call them, and I'm not ashamed or afraid to admit that many times I'm pulling it down. I'm reducing the the size of the weights. So, we all have different, basically everybody's got different tolerance levels. So I'm just kidding, but it's important, when you say heavy weights, how heavy are the weights? But a good question, because I think this comes out of a concern. I think, and please correct me if you're the person who sent in this question. Thank you, but let me know if you get across this video. So, are you talking about how it would affect the IUD staying in place, or would it cause the IUD to pop out, what we call expel, which I think is a great question, and I do get that from time to time. So, where's the question? So this is somebody who either has an IUD already or is thinking of getting one and is interested in, what happens. A big worry of many women, will the IUD pop out? You may not know when it pops out and so on. So let's tackle this. Now, IUD, that is the coil. Okay, so you might know it as the coil, the IUD. There are different types, as you might know. I do have a few videos on the channel talking about it. So you can have the copper coil, or you can have the hormone coil, which is called the Mirena, for example, or JDES, and so many different names. But you have the copper or the non-copper or hormone coil. Now, whether it's copper or hormonal doesn't really affect in terms of its popping out, really. What we know is that the coil is most likely to pop out or to be expelled usually within the first few weeks or months that you've put it in. And that makes sense, because it's at that time when your body is just trying to adjust, or your womb is trying to adjust to this new device, and it might reject it. It's a bit irritated, so it might squeeze it out. So that we expect that's not unusual, and we do say to women to keep an eye. So if you're somebody who's got the coil, remember what your fitter would have said to you when you had it, and that's to keep checking your threads. Make sure you can feel your threads. The other time when a coil is probably most likely to pop out or fall out, what's the best word to use, expel, is around your period or during the period after the period. So that's why we ask you to check monthly on your threads after a period to be sure you can feel them. And so the thing about the coil is, sometimes we know that there are random situations where you can't feel the thread, you're not sure it's there. And of course, the concern about whether you're protected from pregnancy. Listen, if you have that concern, please speak to your doctor. The first thing, obviously, is that we will try to examine to see if we can feel or if we can see the thread. And if we can't as well, then it's a simple matter of referring you for a scan, asking you to use a condom or other form of protection in the meantime. So please don't let that put you off the coil, because, of course, it's a very effective form of birth control. But anyway, back to the question. We're digressing. Let's go back to the question. The other thing, I'm just looking at my notes here, other thing that could affect whether or not a coil stays in place. I can see 15 people are watching, which is great. I really appreciate you guys hanging around. Let me know where you're watching from, and give this video a like. I would really appreciate that. But back to my spiel before I forget where I am. So what else could affect the coil popping out? Again, it might be to do with the shape of the womb. It might even have something to do with the fitter, because sometimes if it's not properly fitted, then thank you for the like. I appreciate that. I'm keeping my eyes on you guys. Snapshots. Thank you. So it may be that it wasn't properly fitted. So instead of sitting right in the body, the top and in the body of the womb itself, it's sort of sitting nearer or even inside the cervix, when it will easily fall out, with a period or during sex or whatever. So the other thing is, the size, the shape of your womb, that might play a role as well. We're different individuals. But that said, let's go to the actual question. Will heavy weights affect the IUD? Now, again, guys, we're assuming that what she's asking about is whether the heavy weight will make the IUD fall out, because I don't know if you guys can think of any other context. If you can, please let me know. But my assumption here is that she's asking whether heavy weights will affect the IUD. Let's read the question again. Does lifting heavy weights affect the IUD? What else do you think that might be referring to? I think it's asking whether lifting heavy weights could make the IUD fall out. So the answer to that is that there isn't any strong evidence that people that lift weights who are wearing the IUD experience the IUD falling out. So there's no strong evidence for that. I will say, though, that if you had your IUD fitted yesterday or today, I wouldn't recommend you going to lift weights within the next 24, 48 hours. Because remember, and it's just a matter of think about it, your body is, or your womb is just trying to adjust to this new product. And when you're lifting the heavy weights, remember that your abdominal muscles are going to clench or squeeze, and that will increase the pressure within the abdomen, pushing on the womb. And the womb itself is already a little bit irritated, doing a bit of cramping itself, which is what happens with the IUD. It'll do, because the womb is a muscle, don't forget. It'll do a little bit of cramping. If the IUD is not properly, firmly secured in there, that is when it could pop out or it could expel. So if you add to that in the first couple of days after fitting, if you add to that lifting heavy weight, that may theoretically, and that's the time when I would advise you, don't go lifting heavy weights. Just sort of take it easy for the first couple of days. After, a week or two, and you're not having any problem with the coil, you feel fine, no irregular bleeding, no pain or anything like that, I'm happy for you to resume your usual exercises, and then sort of work at your own pace. The thing is, people who have an IUD that's about to pop out sometimes may experience some difficulty, like pain, cramping pain. They may experience bleeding. Many times, women don't know when it's popped out. Many times, so it's either one or the other. I think it's important to say that. But within the first couple of days, I don't have any concerns. So we would recommend that within the first couple of days, avoid heavy lifting or straining for the first few days. Allow the coil itself to settle. You can then, after a week or two, everything seems fine, resume your normal exercise pattern, weightlifting pattern. So I think it's a really interesting question. Using the IUD heavy weightlifting, as we define it, lifting, I'm not sure what size weights to call, because like I explained at the beginning, it can vary from one person to the other. But what is normal for you and within your own comfort level is appropriate with the coil, as long as you don't have any issues. I also want to encourage that you are paying attention to your body. So make sure you're looking out for any pain that's, persistent pain, severe pain, irregular bleeding, and then of course keep track of your threads, checking your strings regularly. And then a thought I feel is somebody who is an athlete. If you're an athlete and you do this, your preferred contraceptive is a coil, and this is your concern, have a chat with your provider. Have a chat, because if they're the ones fitting, they know the shape and size of your womb. They understand whether you're in a more likely position to experience the coil popping out easily, and whether your exercise, if you're lifting heavy weights regularly, or a professional athlete, or even an amateur, they will be able to advise better on whether you should be concerned or be thinking about anything else that is an alternative. Okay, guys, I think we've covered this question. So the conclusion for that is, within the first few days of fitting the IUD, I would be concerned about lifting heavy weights, yes, because of the possible effects of increased abdominal pressure on the womb that is still sensitive and just trying to adjust. But after a couple of weeks, it should be fine. We have no scientific evidence that says that heavy weights would affect your IUD. But keep it in mind. And I know that somebody is going to send me a comment and say, well, this is what happened to them. You will have this random, but it's not the same for everybody. So we're looking at generally, we don't have anybody, or we don't have a large group of people saying, oh, this was the problem that they had with their IUD because they were lifting weights. So I hope that helps in terms of covering that question. Guys, please don't forget, it's about having a conversation, being able to provide some clarity that is evidence-based, and encouraging you to go and speak to your own registered provider if you have any further questions or you wanted to clarify anything. So let's call it an evening here. Thank you so much to guys that are watching. I hope you found this helpful, and a special thank you to everybody who's given the video a like, and please consider sharing it with a friend and come back. I do share videos every week. I used to do regular Sunday live streams. I'm hoping to get back to that in the not too distant future. I don't know how it's going to be. I don't know when that's going to be. Which is why when I can do these sort of sudden random, if I see a question that I think, oh, this is interesting, or I want somebody to get the information soon, I'll hop on a live if it's convenient and share with you guys. So thank you so much for watching. I really appreciate spending this time with you. Thank you to Tobias, and I'm sorry I couldn't cover your question. As I've explained, I would need some more detail. And thank you so much to Vero, who was watching from Ghana, for commenting in the comment section and sharing their thoughts. I will see you guys again very soon. Bye.